Have you ever wondered why heart health is so crucial for women? Heart health, often portrayed as a predominantly male concern, is equally, if not more, important for women. The heart, the tireless pump that keeps life flowing through our bodies, is as crucial to women as it is to men. However, the symptoms and signs of heart disease can be different and sometimes more subtle in women, making it a silent and often ignored threat. Heart health in women is a topic that warrants our full attention, as heart disease is the leading cause of death among women across the globe. That's right. It's not just a men's issue. In fact, heart disease claims the lives of 1 in 3 women each year. That's a staggering number, isn't it? More than all forms of cancer combined. Yet, there is a general lack of awareness about its prevalence and the unique symptoms women may experience. Women's heart health is a complex issue, influenced by factors such as age, genetics, lifestyle, and even menopause. It's a silent killer that doesn't discriminate, affecting women of all ages and backgrounds, often without any warning. And what makes it more dangerous is that the symptoms in women can often be misinterpreted or overlooked. Common symptoms such as chest pain are well known, but did you know that symptoms like fatigue, shortness of breath, nausea, or even back pain could be signs of a heart problem in women? Recognizing these symptoms and understanding their significance is the first line of defense in the battle against heart disease. Prevention, early detection, and treatment are key in managing heart disease, and it all starts with understanding the risk factors, understanding the symptoms, and understanding the importance of regular checkups and a heart-healthy lifestyle. So let's delve deeper into this topic and shed some light on the often overlooked and misunderstood symptoms of heart disease in women, because knowledge is power, and in this case, it could be the power to save a life. Understanding the different symptoms of heart issues in women can be the first step towards prevention and treatment. The first symptom we will discuss is chest discomfort. Now, this isn't always a dramatic, debilitating pain that sends you to your knees. Often, it's more subtle than that. For women, it can feel like a build-up of pressure, as if a weight has been placed on the chest. Or it could be a squeezing sensation, almost as if an invisible hand is clutching at your heart. Sometimes it manifests as a sense of fullness, like you've just eaten a large meal but it's centered in your chest. Or it might be a dull ache that refuses to subside. This discomfort is typically located in the center of the chest, but it can also radiate to other parts of the body. The key thing to remember is that chest discomfort isn't always severe or even the most prominent heart attack symptom in women. So the rule of thumb is, when in doubt, seek medical help. Chest discomfort can be a sign of heart disease, but remember, it presents differently in women than in men. Another symptom to look out for is shortness of breath, accompanied by nausea and lightheadedness. These signs can manifest even without the presence of chest discomfort, making it all the more crucial to pay attention to them. Imagine running a marathon, crossing the finish line, gasping for air, your stomach churning and the world spinning around you. Now imagine feeling this way, but without having made a move at all. That's how these symptoms can feel. Shortness of breath isn't just an uncomfortable sensation, it's your body gasping for oxygen. Nausea isn't just an upset stomach, it's your body reacting to stress. Lightheadedness isn't just a passing dizzy spell, it's your body signaling that something's off. These symptoms are not just discomforting, they might be your body's distress signals. If you're experiencing these symptoms without an apparent reason, it might be a good idea to consult a doctor. Stomach pain is another symptom that could indicate a heart issue. Now it's easy to mistake this type of discomfort for something less serious. After all, who hasn't had a case of heartburn after a spicy meal or felt a bit queasy with the flu? Even a stomach ulcer might seem a more likely culprit. But here's the kicker. Stomach pain linked to heart disease doesn't always play by the rules. It can be severe or mild. It can be a constant gnawing feeling or just come and go, like an unwelcome guest. The important thing is not to dismiss it. If you're experiencing stomach pain, particularly if it's accompanied by other symptoms we've discussed, it's crucial to consult with a healthcare professional. This symptom, although not often associated with heart disease, should not be overlooked. The final symptoms to be aware of are unusual sweating, unexplained fatigue, and pain spreading to the arm. Let's first talk about sweating. Now, we all sweat when we're active or when we're feeling the heat, but the type of sweating we're discussing here is different. It's excessive, unexpected, and often occurs without any apparent reason. You might be sitting comfortably in a cool room, yet find yourself breaking out in a cold, clammy sweat. This type of sweating is your body's way of signaling that something is off balance, and it's not to be ignored. Next, we move on to unexplained fatigue. This is not the usual tiredness you feel after a long day at work or an intense workout. This is a profound, unrelenting exhaustion that can make even the simplest of tasks feel like climbing a mountain. It's a fatigue that doesn't improve with rest and can leave you feeling drained and weak. If you find yourself suddenly unable to complete tasks that were previously easy, or if you're constantly feeling wiped out, it's time to consult a healthcare professional. Finally, we come to the symptom of pain spreading to the arm. This pain typically originates in the chest and travels down the arm, but it can also present itself directly in the arm, with no chest discomfort at all. The pain can be intermittent or constant, and it may be accompanied by a feeling of heaviness or pressure. It's also worth noting that while many people experience this pain in their left arm, it can occur in either arm. These symptoms, unusual sweating, unexplained fatigue, and pain spreading to the arm, might seem trivial or easy to brush off individually. However, when they present themselves together, they paint a different picture entirely. They are your body's way of raising a red flag, signaling that something is seriously wrong. These symptoms may not seem serious individually, but when combined, they warrant immediate medical attention. Let's take a moment to recap the 6 symptoms we've discussed today. It's crucial to remember these signs as they might indicate a possible coronary episode, a condition where the heart muscle doesn't get enough blood flow and oxygen. Firstly, we talked about chest discomfort. This isn't always a crushing pain. Sometimes it's just an uncomfortable pressure or squeezing sensation in the center of your chest. It might come and go, but it's not something to ignore. Next, we moved on to shortness of breath, nausea, and lightheadedness. These symptoms can occur independently or together. You might feel breathless while doing everyday activities that normally don't tire you out. Nausea can be a subtle sign, and lightheadedness might make you feel faint or dizzy. The third symptom was stomach pain. It's not the typical heartburn you might think of. This discomfort can feel like a heavy pressure in the abdomen, often mistaken for indigestion or heartburn. Then we discussed 3 more symptoms together: sweating, fatigue, and pain spreading to the arm. Unusual or excessive sweating, particularly when you're not exerting yourself, can be a warning sign. Fatigue, especially in women, can be a significant symptom. It's not just feeling tired, it's an extreme exhaustion that isn't relieved by rest. Lastly, pain can radiate from your chest to your arms, particularly your left arm, but it can also spread to your jaw, neck, or back. Each of these symptoms is a piece of a puzzle. They might appear in different combinations, and their intensity can vary from person to person. But the key takeaway is to pay attention to your body. These are not symptoms to be dismissed or ignored. Remember, your heart health is crucial. Listen to your body and don't hesitate to seek help if you notice these symptoms. Stay healthy, stay aware,